If you'd like to look in the mirror and see someone looking back who seems a little bit more refreshed, the answer may lie in your eyes. Dr. Christopher Maloney of Maloney Plastic Surgery is here to tell us a little bit more about one option to brighten your appearance. Welcome, doctor.
Thank you.
We're going to talk a little bit more about eyelids, how they can really refresh your look. First of all, let's talk a little bit about you. What's your background?
Well, I grew up here in Tucson, Arizona, which is how I ended up back here in Tucson. I went to college in San Diego and medical school at Columbia in New York. I did general surgery training at Vanderbilt and my formal plastic surgery training at Harvard in Boston.
All right, very well qualified, I'm sure, to do eyelid surgery then. What exactly is eyelid surgery?
Basically, eyelid surgery involves two different things. One, it's either your upper eyelids or your lower eyelids or both. So it's one of the most common facial plastic surgical procedures that I perform. It's very common. It's very easy to recover, and oftentimes we do it on a patient who's awake in the office, which eliminates the concerns about postoperative nausea and vomiting, as well as holding down the cost of having to go to a hospital or a facility to have it done.
Absolutely. And you talked about upper and lower. How exactly is that performed? Because I think a lot of people don't think about the lower eyelid.
There's a lot of different techniques that are available. Basically, there's two different components to eyelid surgery. One is excess skin, and the other is excess fat. So if you look at some pictures that are on the screen, you can see on the left is before surgery and the right is after surgery. And you can see in the upper eyelids where on the left there's a lot of extra skin that oftentimes shows hooding. And on the right, you can see the upper eyelid looks more open and more awake.
That one on the top left looks almost like a different person. You really fixed that one.
Correct. And there's a lot of people that actually have enough extra upper eyelid skin that it can actually start to impair their lateral vision.
Oh, I could see that. Do you get a lot of those?
Mainly it's for cosmetic purposes, because when you start to get that much skin, it starts to bother people enough where they are looking for solutions before it gets that severe.
And tell us a little bit more about how exactly it's performed. We know why, but how exactly?
So basically, if it's involving skin and or fat, a patient would come in and we use a little bit of numbing medicine, just like you were going to get a dental procedure, and we put the upper eyelids and the lower eyelids to sleep. Once they're asleep, the operation of the procedure is painless, excuse me, and involves removing some excess skin, removing some excess fat, and oftentimes tightening the muscles and the structures around the eye to give a more youthful appearance.
And how long does this last?
It lasts forever. It's very uncommon.
Forever?
It's very uncommon that we ever have to repeat eyelid surgery.
That's fantastic. What's the recovery time?
The recovery time, like I said, it takes about an hour to 2 hours, depending upon the extent of this operation performed. You go home the same day and you have stitches that stay in for about 5 days. After that, depending upon the extent of the bruising that you have, the recovery may be anywhere from 1 to 2 weeks.
That's fantastic. Who would you say is a good candidate? We talked a little bit about the reconstructive, about people who may have that impairment. Who, though, would you say is a really good candidate for this surgery?
I think patients that look at themselves in the mirror, especially women that start putting makeup on their upper eyelid and they realize, boy, I have a lot of excess skin. It's one of the procedures that really can make a huge difference, where you can't see the scar, it looks very natural, and the complication rates are very, very small. So that's really sort of with the upper eyelids, the first type of person that I would see. With the lower eyelids, it's usually someone who's noticing excess fat, or what they say, bags under my eyes, and it gives them a more aged appearance. Someone who sort of has that type of look is someone that might come in to talk about their lower eyelids.
And let's talk a little bit more about the lower eyelids. You mentioned the bags under your eyes. Is that the puffiness, or is it the sort of the ridge you get underneath your eye? What exactly are we talking about with lower eyelid surgery?
It's sort of hard to describe without actually showing you a patient or an individual, but you sort of know. You can look back at pictures when you were younger and your eyes look great, and then as we age, we start to notice excess skin and excess fat and a change in the shape of our lower eyelids. And it's pretty self-evident when someone has those problems.
You just know, huh? You just know you need that look. Let's talk a little bit more about Maloney Plastic Surgery. What can we expect when we walk through the doors? How can we expect to be treated and welcomed?
Well, when someone comes in, basically we have plenty of time to meet with the patient. We first talk to them about what's bothered them, why they come to see us, and then we basically go through a series of photographs to show them before and afters to help them understand what the process would involve, as well as what the perfect operation for them is. Because sometimes it's not just involving your eyelids. You may need a brow lift or a facelift or all of those together. So it's important to show someone pictures before and after, and actually to show the person, when you're comparing it to them, what they can expect.
And obviously they have a lot of guidance at your office, but what are some of the things that you suggest that people evaluate before they do take these things on that may change their appearance maybe a little bit or maybe drastically?
I would certainly say buyer beware. I mean, pick someone that's a board-certified plastic surgeon, someone that's got experience and someone that's got a reputation that you can trust. Because what you don't want to have happen is have somebody come in and tell you that this is not a surgical procedure, or have somebody do something to you that can't really take care of you during the post-operative period, or God forbid if you were to have a complication.
Yes.
So it's best to stay with someone that's well-trained, it's board-certified, and has the experience to deliver the result that you're looking for.
All right, good advice. Thank you, doctor.
Thank you.
And if you are thinking about enhancing your look, just call Maloney Plastic Surgery at 298-2330 or go online to maloneyplasticsurgery.com. And if you mention you saw them right here on The Morning Blend, you can get your consult fee waived. Again, just mention you saw them on The Morning Blend when you call this number, 298-2330, or you can go online, maloneyplasticsurgery.com. And don't go anywhere, The Morning Blend will be back in just a couple of minutes.